The Vial of Life, can anybody get that document and fill that out so that they have it readily available on the fridge if there were an emergency? It's not saying that there is going to be an emergent situation with their loved one, but as we age, there could be.
Just in case.
Yes.
Yeah.
So can they pick that up at their local fire department or print it online?
Yeah, a lot of fire departments have them, and they just hand them out to the community members.
Yeah.
I'm pretty sure you can order them off of Amazon.
Oh,
Places
okay.
like that. I think you could probably pick them up at like a CVS or a local pharmacy.
Yeah.
They're not real hard to get a hold of, and even if you don't have this little file per se,
Yeah.
you can always just put the medication list and the patient's medical history, and just leave it on the fridge. Like,
Sure.
just stick it on with a magnet, and that will be suffice too. Like, that
Sure.
way the first responders know to look. That's the first place I go to
I was
look.
going to say, they should make that universal.
Sure.
That
Sure.
when any paramedic is walking through the door, you know exactly where to go to find that information.
Well,
and
they
families,
definitely do that with the DNR.
They do.
Yeah.
Like that,
As long
they
as
tell
you're
you,
telling
hang it
people
on
to
the
post it.
Yeah. Or put it next to the bed on the wall
Right.
or whatever. So they make that visible and they make that like a universal thing.
Right.
But I've never even heard of this.
Me either.
Yeah. You're watching A3 Aging Ann Arbor, where we talk about aging and what you need to know. I'm Faye Molitor.
And I'm Shelia Doden.
Welcome to the show. Welcome to A3 Aging Ann Arbor. We would very much like to introduce Amber Sheil. Amber actually works for us. She is our community liaison. She is our educator, and she also does our assessments in the community. She has a bachelor's in nursing, and she's a critical care paramedic. This woman, seriously, you are amazing. You really are. And I know you don't like to toot your own horn, so I'll toot it for you.
Okay, that's fine with me.
Is that fair?
Oh, yeah.
Okay. So we are going to touch on the subject of geriatrics in your field of as being a paramedic. Mostly the geriatric aspect of it, and all of the challenges that you probably face in dealing with some of our elderly population when they are in dire need and you are entering the home, and how critical that is. But I know that a lot of these folks are alone and they don't have family living with them, and they are not necessarily great at putting their med management together or their themselves together at all. Mobility issues, eating issues, all of those things. So we'll start with, I think I heard the term bag of meds. I guess the best way to start is to say, what are some of the biggest challenges that you see when you're going into a home of an elderly person that is in critical need?
That is such an in-depth topic, honestly.
I know. It's probably all over the spectrum.
It is. A lot of times we see people who have issues with falls, medications, they get them mixed up because as we age, cataracts and vision issues with glaucoma and different things like that cause pill mix-ups. So they can't tell if they're taking their morning pills or their night pills. And when we're younger, we can see those color differences on the tablets, but as we age, like certain colors can kind of blend together and they almost look the same. The ability to bathe and wash themselves is an issue.
Sure.
Just basic cleaning, just so much. So
yeah, hygiene. Oh man, I can imagine that's so hard. And their dignity is taken from them. And then they have an emergent situation and you guys are walking in. Oh my goodness. That's so what do you feel would be some key points that people should keep in mind or put in place that would be helpful to their loved ones or to them if they're on their own, that would maybe help you guys as paramedics when you're walking into the home? Like, does that make sense? Is that like a
Yeah.
too open-ended question?
Oh
Okay.
no, there's lots of things that people can do actually.
Yeah.
Medications, like a lot of times, we'll find them. You mentioned the bago meds. That can be difficult because sometimes the medications aren't all together.
Sure.
There might be stuff that's expired in that bago
Sure.
meds. A vial of life is what we use. I was a firefighter for 5 years with Riverview, the city of Riverview, and we would hand out free little, it's like a little magnet, and it has a paper, and you just write the list of the current medications,
Oh,
the
nice.
doses, and the times, and then allergies, medication or medical history, stuff like that. And it goes right on the fridge. So the first thing that we looked for was that vial of life that
Hmm.
contained the most pertinent information for that patient. So
And that's something that you guys provided through the city of Riverview. By the way,
we
that's
did.
my city. I live there. So I'm proud to say
It's a
that you
great
were a
city.
firefighter there. That's so cool.
Yeah,
It
I
is a
loved it
great
there.
city.
It was nice to be part of the community.
Yeah.
It was so fun.
Oh,
Yeah.
good.
So
I like the community too.
Yeah. And I'm sure that if with the vial of life that you're talking about, if someone's visiting their physician and you're taking, your loved one to a doctor's appointment or something along those lines, they should be able to provide them with a pretty comprehensive list of their medications as well that they could maybe put in their purse or in the bag o' meds
yeah.
when you walk through the door, so you've got it with a date on it that it was, provided to the patient. Why is that? Why is that so important that you understand the meds that they're taking?
Well, there's a lot of biopsychosocial factors that can tie into that. As we age, a lot of us start developing hypertension, for example.
Mm-hmm.
And, like we have medications that, like, for example, metoprolol is a very, very common one. It will actually prevent your heart rate from going up. So if you have an injury, your heart rate can't go up physically,
Mm-hmm.
and in turn your body has a more difficult time compensating.
Mm-hmm.
So if you have a patient or a client that's on the floor for a long time, their blood pressure starts to drop too low because they've been laying on the floor for 24 hours. um, it's hard for them to like compensate physically to keep their blood pressure up. So just knowing those things, it's very important for us. Knowing allergies, because
Sure.
there's certain medications that people are dangerously allergic to, and
Mm-hmm.
it's good for us to know that, because usually when we get on scene in the EMS setting, we're walking into the Wild West. We have
Mm-hmm.
no idea where anything's at, what the patient is like, what their normal mental
Mm.
status is. So we're just walking in just completely blind. So
Sure.
having some kind of baseline is so, so, so important, is so useful.
Mm-hmm. That's awesome. We're hoping that people actually understand how important it is to put things in place, so that when you guys walk in, that's the whole purpose of this show, is to, educate people on what it's going to look like for you guys when you walk in there, so that you can provide the best care possible to their loved one or them, if it's that person that is dealing with their own stuff. Um, the What did you call it? The document?
The Vial of Life.
The
Um,
Vial of Life.
yeah, that's
So
what.
the Vial of Life, can anybody get that document and fill that out so that they have it readily available on the fridge if there were an emergency? It's not saying that there is going to be an emergent situation with their loved one, but as we age, there could be.
Just in case.
Yes.
Yeah.
So can they pick that up at their local fire department or print it online?
Yeah, a lot of fire departments have them, and they just hand them out to the community members.
Yeah.
I know, I'm pretty sure you can order them off of Amazon,
Oh,
places
okay.
like that. I think you could probably pick them up at like a CVS or a local pharmacy.
Yeah.
They're not real hard to get a hold of, and even if you don't have this little file per se,
Yeah.
you can always just put the medication list and the patient's medical history, and just leave it on the fridge. Like,
Sure.
just stick it on with a magnet, and that will be suffice too. Like, that
Sure.
way the first responders know to look. That's the first place I go to
I was
look.
going to say they should make that universal.
Sure.
That
Sure.
when any paramedic is walking through the door, you know exactly where to go to find that information.
Well,
and
they
families,
definitely do that with the DNR.
They do.
Yeah.
Like that,
As long
they
as
tell
you're
you,
telling
hang it
people
on
to
the
post it.
Yeah. Or put it next to the bed on the wall
Right.
or whatever. So they make that visible and they make that like a universal thing.
Right.
But I've never even heard of this.
Me either.
Yeah.
Yeah.
So-
and sometimes it just comes down to education and
Yeah.
just passing along the knowledge around,
Mhm.
just because a lot of families, they don't know this is new for them, and their loved one is getting older and they're needing more assistance in the
Mhm.
home, things like that. So, just communicating, and we try to, like, obviously get that word out there and
Yeah.
make that
Sure.
known.
So I guess one of the things I'm wondering about, and maybe it's an obvious question, but we could speak to it. Are these folks reluctant to tell you when you're walking through the door, kind of what's going on with them? I mean, if they're able to communicate, and if they and if you feel like that's an accurate depiction, why do you think that is?
Um, I think there's a couple different thought processes with that. Sometimes we just get weird calls,
Mhm.
and it's just one of those things. I've had a couple people that have tried to self-catheterize
Oh.
and using the wrong materials.
Mhm.
We had a guy who had a Bic pin stuck
Oh,
in
Lord
there
have
in the urethra.
mercy.
So in situations like that, they're very
Dire
hesitant
situation. I mean, I guess desperate. There's
desperate.
desperate people do desperate things, and that was a desperate moment. Holy cow.
Yeah, so
Yikes.
it can be in those situations
Don't
where
do
it's
this,
embarrassing.
folks.
No,
Yeah.
don't do that. Talk to your doctor. They have straight casts for
Yes.
that.
But I mean, you're walking
They have
in, and
sterile straight calves for that. They're-
when you're walking into that's very telling to you,
Oh.
right? But if it's not,
That's a sad situation.
if it's not a situation like that,
Usually
and
people
you're
are
not
pretty open.
visually seeing, okay, wow, that's not
Yeah.
good.
Yikes.
And obviously, they, without speaking words, you can see exactly what the trouble is. But if you don't see something like that, are people reluctant to talk to you about maybe what's going on?
Usually I find more of an issue with people that don't really know what's going on. They're
Mhm.
just, they don't feel well, or,
Mm.
there's just some kind of vague complaint. And a
Mhm.
lot of times it's more of like, they can't express what's wrong or
Mhm.
what's going on, really.
Mhm.
So it's hard to navigate through what's chronic and what's
Yeah.
acute issues, and like why we're there today.
Mhm.
So that's kind of like the most common thing that I've found.
Yeah. So it sounds to me like just because you just offered that scenario of that gentleman who would use a Bic
Mm.
pen. So that would happen, I would believe, because he isn't really keen on doctors and not really getting any kind of medical attention that he so badly needed. And so I'm sure that's 9 times out of 10 this scenario that you're walking into. So if they haven't been to the doctor and they don't have a primary care physician, then you're really walking into kind of a blind scenario
Yeah.
because you don't have a med list. You don't have an idea of what their possible condition could be. You are literally having to identify what the condition is and then treat it in order to get them to where they need to go, if they will go.
Yeah.
So how many of those scenarios do you have where they're like, absolutely not, I'm not leaving my house, and that they absolutely have to or should.
Mm-hmm.
It's in their best interest.
Yeah. A lot a lot, especially if they're afraid of going to the doctor or there's some kind of apprehension. Maybe they had a poor experience in the past, even. Um, I've gone on calls where we've had patients having a massive heart attack, and you can tell they look sick, and everything
Mm.
indicates that, there's something really bad going on, and they are adamant about not going. And,
Mm.
and it's heartbreaking to see that. But so we try to instill a level of confidence
Sure.
with these people that we encounter,
Sure.
and even education on the less serious situations. Like, I work in Detroit a lot, and there's just such a great need for education.
Yes.
And a lot of the calls that I respond to often, it's just people needing some reassurance and needing that education that they just so desperately need.
Yeah.
And a lot of times, and I can't say it's the fault of physicians or, hospitals or anything like that, but we see a lot of times that folks are walking out with their loved ones, or the person that is being treated is walking out. And you're absolutely right. If they're adding a new medication and they're not educating these folks on why it's important to take it, or how to take it, or anything new that they might be experiencing. They're so busy in the hospitals that that education component, they just assume that they're telling this person, okay, you have this medication and this is what it's for, and leave them with that, and not really give them the backstory
Right.
on why it's important that they not take it, what to do with the equipment that they're sending home with them. I mean, so having
Yeah.
you out, being those first responders and reinforcing some of that education, I guess, is a good thing. The hard part is they should have had it to begin with. And if they did, maybe you wouldn't be there.
Yeah.
How often do you come in contact with folks that I just feel like there's so much denial in the medical field, especially in a hospital, with dementia? Like, I just don't feel like they really understand the extreme of the dementia that the patient has. And then they are sending them home and thinking that, oh,
They're fine.
they're fine. Yeah, they just have a
They were
little
just
bit of
confused.
short-term memory loss, but they're literally like in major dementia.
It's pretty common, especially there's certain things that you can't assess. And this is
Yeah.
one thing that I've learned um in the past few months. I've ran in and kind of encountered clients or patients that they seem pretty oriented.
Yeah.
And you're like, well, maybe they need some help around the house.
Yeah.
Like, nothing too crazy, maybe a little minimal, assistance.
Yeah.
But when it comes down to it, as you kind of start talking to the family and start
Yeah.
understanding more, we had one that she wasn't even able to operate a microwave
Right.
to cook a frozen dinner.
Yeah.
And that's a problem
Sure.
if she's living by herself
Yeah.
and there's no one around to assist her.
Right. It is a chronic issue, and people just think that because they can have a social chit chat moment with you, and oh yeah, everything's fine, and I'm doing good, and yeah, whatever. My daughter's here, and blah blah blah, and it seems like it's a very lucid moment. However, their short-term memory is depleted. That microwave is a super new appliance in the house, and they have no idea how to use it, so they can't cook, or they've just gotten rid of an old stove that's broken down, put a new stove in there, and they don't know how to use it. A lot of times folks are in major denial over the fact that their loved one has any kind of dementia. They don't want to call it dementia, so we will typically just say, well, they have some short-term memory loss,
Mm-hmm.
because that's what it is in all
Yeah.
reality. But it's way more advanced than they really are aware of, and it's causing all of the issues: the lack of taking the meds, taking them wrong, all of the things
Hiding
that you
them in
walk
different
into.
places in the
Yeah,
house.
yeah,
Yeah. Yeah.
yeah. So how often do you deal with a situation where you have to call Adult Protective Services?
More often than I'd like to really absolutely
I was hoping
acknowledge,
that wasn't going to be
you
the
know,
answer. Yeah.
um, and even when you take those steps,
Hmm.
there's times that, like people tend to fall through the cracks,
Sure. Oh,
and
I know.
it's like, what do you do now?
Yeah.
So
Yeah.
And those
it's
are your
difficult.
repeat offenders?
Yeah.
I mean, not offenders,
Yeah,
but the repeat
the
calls,
repeat,
The
yeah, the
frequent
frequent flyers.
flyers.
yeah,
Yeah. I mean, that's
Yeah.
got to be really hard to continue to have to go and see these people frequently and do everything on the backside that you can, is the right thing to do for them, but then they fall through the cracks. I mean, do you see any change in that at any point? Is there anything that you think maybe could be done to ward some of that off? I mean,
It really is a really complex network of support that's
Mm.
required for these people. I wish we were seeing better results, but it really has to do with the family, the healthcare providers,
Sure.
from the doctors all the way down to respiratory therapists,
Sure.
to PT, to OT. Like our GEMS training really kind of brings
Yeah.
a lot of that out, and it talks about the complexity of the network that is
Yeah.
needed to provide these people with the best healthcare
Yeah.
possible. So
Yeah.
I would like to see it improve, and
Sure.
that's why I'm here with senior helpers, really, is to try and improve that, so I don't
Yeah.
like have to transport these people, in my EMS job.
Mm-hmm.
We want to reduce those falls. We want to increase health. We want to increase medication compliance.
Mm-hmm.
So it's a work in progress, and it's a big animal, but I think we're gonna get there. Hopefully soon,
Yeah.
soon, soon.
Well, there's so many people that do what Senior Helpers does. There's many, many companies that provide home care, the non-medical side of home care. It's just bringing that awareness to folks. And now that you have it, and now we understand how important it is to get that word out to paramedics and EMS, because I don't even think you guys even realized. I think you knew that there were businesses out there that did what we did, but I don't think you knew the larger scale of people that do what we do. And now that I remember you saying, well, now that I'm aware of this, this is amazing. This is a game changer for a lot of the people that that you see.
Yeah,
So that's a beautiful thing. So hopefully the word will get out and people understand you don't have to have home care every day.
right.
You can take home care once every month if you need to. Well, that's how we work. I don't know that all home care industries or companies do it that way. We don't set limits on helping people. So it's 1 hour all the way up to live-in care, but it can be one day once a month if needed. That could be a game changer for these folks, just to help them get their meds in order, to help them get their meals prepped, to help them get their home cleaned. Yeah. Obviously, people need more than that, that you see, but it doesn't have to be a lot.
Right. Just a little bit of time,
Mhm.
like even just to kind of give the families a little bit of reprieve
Sure.
from having to be over there every single day. It gives the families a little bit of a break so that they know that they don't have to go that day,
Yeah.
and there's a caregiver that's going to be there at the home of their
Mhm.
family, making sure that they're eating, making sure that they're bathed, or
Yeah.
whatever tasks are necessary, that they're safe.
Mhm.
Like I've encountered patients in the EMS world that they've been on the floor for well over 24 hours, and now they have urine all over their clothes. Their blood
Mhm.
sugar is really, really low. Their body temperature is low. Their blood pressures are low. They have head injuries, and at this point, when you get that sick and you're that injured and you're
Yeah.
laying on a cold cement floor for well over 24 hours, that could have been avoided just by having someone there
Pop
once
in.
once every couple days,
Mhm.
or whatever the need might be.
Mhm.
And luckily for that patient, he did survive. He had a good outcome, and he actually lived
Good.
another like 5 years
Oh, good.
until he ended up with a terminal type of cancer. But, you
Mm.
know, he actually thanked us at the fire department because he was like, you saved my life. And, you know, we did literally everything that we could to treat him on the
Mm.
emergency side. And then he recovered through in the ICU. He had a subarachnoid bleed as well. You know, so he had a long road, but he got through it and went to rehab and then went home. So
That's good.
I would like to start seeing people not have those severe emergencies though.
Sure.
And that's a nice part about in-home care is because
Mhm.
we can provide an assistant, you
Mhm.
know, with that and help the families and
Yeah. Yeah.
give them more of a support group.
Yes.
So I'm kind of shifting gears a little bit. I'm just curious, what is like the standard as a critical care paramedic? What's the standard kind of protocol that you use when you're walking through someone's door? Like, walk us through what that looks like.
All right. Well, I guess we get to go back to EMS training 101, which was really hard actually to do to transition from the EMS to the nursing mindset. It was a very big challenge,
Mhm.
but I did it. So basically, it's scene safe BSI. So you walk in, you look around, you're looking outside, you're looking at the door, you're looking at the home. You know, what kind of condition is the home in? What time of day is it? Is it raining right now? Is it cloudy? Is it windy? Is it a blizzard? I don't know. It could
Mhm.
be like a million things.
Mhm.
So you get into the home, you're going to check the door. Well, sometimes the door's locked.
Mhm.
Sometimes there's no family. Sometimes there's no key.
Mhm.
You know, a lot of our frequent flyers, we'll refer
Mhm.
them to, you know, they will have a key with a lockbox or some kind of keypad often, but sometimes you don't have that. So even in the ambulance, when I was a firefighter, we actually had a pry bar to enter into the homes. And we hated doing that because obviously it causes damage to
Sure.
the structure of the door frame and everything like that. So we did everything that we could to, in a timely manner, make it into the house without causing
Right.
any damage to the property. Once you walk inside, you're looking around, you know, is it safe? Do you hear dogs barking? Anything like that?
Mhm.
Is there anyone else in the home? You know,
Mhm.
where's my patient?
Mhm.
Who called 911?
Mhm.
You know, all those things are like a factor into developing like a scene in your mind before you even walk in. And, you know, before you even find your patient, like you're walking into the home and you're thinking of scenarios that could, best case scenario and worst case scenario.
Mhm.
So you're thinking about, well, they could just be sleeping.
Mhm.
Yeah, that's the best case scenario.
Mhm.
Sure.
Worst case scenario, well, they may have had cardiac arrest, you know, or they
Mhm.
may have fallen and now they're very injured.
Mhm.
So luckily, you know, we don't run into the cardiac arrests a whole lot, thankfully.
Mhm.
Because the best part of medicine is actually being able to help people and
Sure.
recover them.
Oh,
So,
yeah.
um, yeah, so you just, you know, you're obviously safety is a big issue.
Sure.
So, you
Well,
know,
especially in some of the more inner city areas, I'm sure you've walked into some
yes.
really interesting situations, right?
Oh, yeah.
Yeah. What's one of the most
Oh my
interesting?
goodness.
Can you
Gosh.
even talk about it?
Well, we recently worked in Detroit and we all know that the crime rate is much higher
Sure.
there. The violence level is much higher there. And I love the city of Detroit though.
Me
Like
too.
the people are amazing.
Mhm.
I love being able to educate and make a big difference in people's lives and you know, like the small humans, like the little
Mhm.
kids. Like
Mhm.
I love encountering them because they're
Yeah.
so full of hope still and
Mhm.
so full of love and energy and
Mhm.
they're so cool.
Mhm.
So, you know, just impacting them in a positive manner, like
Sure.
because you know they often have a fear of police and things like that, and
Sure.
firefighters and EMS. So making a positive like impact on them is
Yeah.
probably one of the things that bring me such great joy.
Yeah.
Aw.
You know,
Yeah.
just creating like a safe interaction. You
Yes.
know, because not all police are bad, not all
Right.
firefighters are bad, like not all EMS, but you know they're all kind of grouped into one,
Yeah.
and it does create a level of like
Fear.
fear, yeah, and anxiety and apprehension. So
Mhm.
it's nice to be able to create a like a positive
Yeah.
encounter with
Yeah.
them.
Yeah. Plant a positive seed. It's
Yeah,
a beautiful thing.
absolutely. I mean, but we get crazy things in Detroit. I mean, just all kinds of, so much stuff. There was one call recently that we had it was for a headache, quote unquote. And we got probably about 4 or 5 houses from where the address was listed. And I noticed a guy walking on the sidewalk in a plaid shirt. And he was on his phone. Okay, no big deal. Like, you notice everything around you, like, at all times. And so he starts, like, running down the sidewalk and waving his arms. And I'm like, okay, what's going on with this guy?
Yeah.
And so as soon as that happened, dispatch comes over the air and was like, okay, it's not safe. There's been other calls reporting sounds of gunshots in the area. And so my partner was just like, like, okay, I'm driving. I'm like, no, drive. Because I'm like, I do not want to be exposed to the potential of a shooting. And that is standard protocol.
Oh, for gosh sakes.
So we have to wait on scene. For, like, so what we do is we'll post, a little ways away.
Sure.
In a little bit more of a discreet area. For safety purposes until PD gets on scene.
Okay. Wow.
So,
That's
man, those are the things that you just don't even think about.
Adrenaline.
Like,
yes, I've never experienced that, and to think I almost became a Detroit police officer, and I veered away from that. But
that's a big.
You're still seeing a lot of it, though.
I do, yeah.
So
you're
still doing good work.
Thank you. Yeah.
Sure.
So
oh my gosh, in so many ways.
It's in a different way.
In so many ways.
Yeah. So if I wanted to say that was probably the most fear that I've ever experienced in my life, it definitely was. Especially being, we're EMS. We're not trained to deal with volatile situations.
Right.
We're not trained to deal with violent situations. So, we did stage around, I'll just be a little vague about that. But we did stage in the area and we waited for PD to get on scene. And it's unfortunate that we have to do that because what if there is a person that's been shot?
Cardiac arrest
or in cardiac arrest
need
or
help
need
now.
medical attention. And unfortunately we just can't because I want to go home to my family.
Absolutely.
So and especially with the way that the gangs and like different like groups of people, the shooters will come back and they will target EMS because they do not want the person that they shot to be alive,
to survive.
Yeah.
Holy cow.
So the
so
risk
it's like a gang
so
situation where
typically.
they're or whatever.
Oh, when you're trying to get to an elderly person who needs help,
a person
that's
scary.
So we don't know, and that's one of the things we don't know what we're walking into ever. So
wow, that's insane.
It is.
You're a superwoman.
I try.
Yeah. So, what community resources do you guys reach out to for for help for folks? Like, do you guys offer up list of community resources to these folks when you walk in because you see that this need is there, this need is there? Do you guys offer that?
Actually, I have to say we don't.
Okay.
And the only reason is because I never even knew about home care services or extra resources for these.
That is insane to me. How can we change that?
Well, it's a learning experience for me. And, I think just being involved with EMS education would probably be the most effective way to kind of get that out there.
Yeah.
I'm not currently involved with EMS education. I was for a couple years, but I have a very busy schedule. So.
Yes, you do. Yes, you do. And we really appreciate you being here.
Oh, yeah. No, it's a pleasure. It's a pleasure.
So that's too bad. Because in all reality, I am sure a lot of the scenarios that you see because these folks maybe can't get out of their house to get what they need or to get to appointments that they need to get to. Their meds are a mess. So you name it. Meals on Wheels is there because they're not eating. There's so many different community resources that are volunteer based. They don't even cost anything to these folks. And I understand paramedics aren't necessarily the social workers of the world that are going to offer that, but just to have brochures or pamphlets or something that has community resources on it, like the Area Agency on Aging document lists every volunteer-based and every home care and all of us. is on the area agency on aging, and those are in each county. So for Wayne County, there should be a document like that. And it might be a good idea to think about if, I don't know if you could
Put that bug in
push
somebody's
this-
I
ear.
think
push
I
this
might actually.
envelope,
Yeah.
but put the bug in their ear to keep that. What is it? It's a document that you could keep in a pocket somewhere on the EMS truck and just make sure that they get it
Yeah.
if they need it, because that might be a game changer for them.
Yeah.
You're
absolutely.
saving them, but it's going to end up happening again.
Yes.
You
And
know?
that's a fantastic idea. Actually, like the more I get involved with the senior helpers, and the more I get involved with the communities and just in conversation, like some of the things I'm like, I never even thought about it,
sure.
So
Well, when you know better, you do better.
Yeah,
right?
absolutely.
Yeah.
And we've learned a lot from you as well. So it's a nice
Oh, yeah. For sure.
reciprocation.
No,
on
that's
both
why you're on the
sides.
show.
Exactly.
Oh, thank you.
So,
But
You have so much to offer people, and we just felt like it was very important that you be able to offer your wealth of knowledge. Yeah.
so the question that we ask all of our guests is, and I think we threw this at you before.
And if we didn't, I think she can answer
can
it
answer it.
probably eloquently.
Yep. So what does aging well look like for you?
you know what? I think that trying to maintain one's health, one's both physically, mentally, emotionally, spiritually, maintaining a support group,
Yes.
And there's so many resources. As I go through and just experience more things, I learn how many resources there really are in the communities that like no one really knows about.
Mm-hmm.
So I think that having those resources, and because we all know that if at some point we're going to start getting to the point where we're having trouble with something, whether it's our vision or our, how well we're ambulating, or
Some of us sooner than others.
exactly. But I mean, and it's just, I think that having those resources and maintaining those, those levels of health and connections and things like that would probably be the best way to age gracefully. And unfortunately, I think that there's some people that will need more support than others. And, but those resources are out there for the community members.
Yeah.
So it's
they
just a
need to
matter
be
of
aware
education.
of them.
Yeah.
Yeah. Like you said, educate. It's not only for the folks that you work with, but the folks that your peers that you're working with, your coworkers, but for the folks in the community as well.
Yeah.
Yeah. And Detroit, they're doing so much to build the community and to pull everybody together. And I know there's still, some challenges with crime, but the more that they understand, I think the community is only going to get better. So yeah, offering any kind of information to them is a good thing. So hopefully this area agency on aging resource document will be a game changer too.
Yeah,
because if they know that those services are available out in the community, they're going to use them, especially if it's volunteer based and there's no money out of their pocket. They can't afford it a lot of times. So.
And I think a good thought process on that is like if some communication was in place to see if maybe we can get some of those flyers or pamphlets or whatever, some of that information onto some of the BLS trucks, which is the basic life support trucks. Those are the crews that are usually taking people home, and they're there to see, what kind of environment that client has, and they're also there often with family, and it'll allow for a different level of communication after the emergency, after the patient or the client is at home.
Even
and better and healthy now. So.
Yeah. Oh, great. Yeah, that's great. If they're taking them home, that's even better, because then they can, here you go. If you need anything, this list will give you any of the resources you need. Yes. Yeah.
Super cool.
Yeah.
Well, thanks so much for joining us, Amber.
Yeah, well, thank you guys.
Really, really good information.
Thank you for joining us, and thank you for all you do. You really do make a difference in the world, Amber. It's a beautiful thing. So I know you've made a difference with our clients, like already, and you haven't been with us that long. So we're super happy to have you.
Well, thank you guys. It's
Yeah.
been a pleasure.
Yeah.
And thanks for joining us on A3 Aging Ann Arbor.
Please click the bell button below and subscribe. This program is sponsored by Senior Helpers. That was A3 Aging Ann Arbor, your source for all things aging.
Please like, share, and subscribe for more episodes. Thanks for watching.
This episode was sponsored by Senior Helpers of Ann Arbor.